important advance in this area has been the introduction of oral iron chelators. And two of these that are available are being used more and more commonly. And in fact, some of the most dramatic improvements in survival in chronically transfused patients with diseases like thalassemia and sickle cell anemia have come from the profound improvements that have been made in survival of these patients just because of introduction of iron chelation therapy that's readily available through these oral agents. So in terms of treatment, there are two oral chelators that are available. The first is Feriprox, which is approved as second-line treatment for thalassemia. In my practice, for myelodysplastic syndromes patients, the drug that I used as a very effective iron chelator is Exjade. It has really changed the way I have been treating lower risk MDS patients because it's made it so much more palatable and simple to institute iron chelation now. And when we are seeing patients with lower risk MDS who are getting chronically transfused, it is very, very important to initiate iron chelation therapy early to continue it, bring down the ferritin level to a desirable limit, and even stop the chelation, let it build back once again and reinitiate. So even episodic and intermittent chelation is extremely important.
If we have too much iron, it accelerates the rate at which we age. And at least 10 to 15% of the population has too much iron. In fact, some people think as many as 40%. The disease is called hemochromatosis, and most of us have never heard of it. We know that when there's too much iron in our system, it causes a lot of free radicals to occur. So when iron gets inside the body, it causes very, very dangerous free radicals to form in large amounts. For that are really sick, they tend to die early. They have problems with liver disease, they get cirrhosis, diabetes, they have arthritis, erectile dysfunction, heart attacks, and strokes. They have cancer, pituitary dysfunction. They have a particular hue to their skin that you can see. We have to be very careful about taking too much iron in, so we don't want to be cooking with pots that are made out of iron, and we certainly don't want to be taking any multivitamins that have iron either. Iron is something that can be lethal, and we really need to measure it. You should ask your doctor if you've not had your iron levels measured, that you should do that. It's a simple test. You certainly want to know it.
Today I want to talk about the dangers of a carnivore diet, which consists of a lot of red meat. The primary danger is iron overload and iron overdose. Men, we don't have a menstruation cycle, and we also amalgamate and store iron in the body, in the glands and different organs. And iron is a metal just the same way that mercury is a metal, aluminum is a metal, lead is a metal, arsenic is a metal, and so on. And all metals, if they amalgamate too much in the body, they cause physical degeneration, and they are associated with almost every single disease out there because they damage the organs. They literally kill cells. And so if you're eating a lot of red meat and storing iron in the body, it stores in the brain and you have poor brain function. It stores in the testes and you lose testosterone and libido. It stores in the liver and you get liver damage. There's actually a disease associated with this, and it's called hemochromatosis. It's where the body stores far too much iron. Now, I know there are popular carnivore influencers who are eating like this for, a considerable length of time, and they ended up going off of the diet because they damaged their organs, and it was due to iron poisoning. They poisoned themselves with iron. This is something which, if you don't confront and listen to when the symptoms initially arise, and you keep persisting, it gets worse and worse, and it becomes more difficult to reverse. I have two articles linked in the description. They are from two of my mentors, which I have learned a lot from, Dr. Raymond Peat and Dr. Lawrence Wilson, MD. Phenomenal physicians, phenomenal doctors, and of course they use their critical thinking faculty. They don't exist really in the mainstream sphere. They use their own minds and have their own independent opinions. And they have two articles written on the dangers of iron overloading and iron overdose. So go ahead and read those. But I'm going to now talk about how, from a historical perspective, different cultures and peoples address this issue, iron overload, because it was very common always throughout history. Prior to the 19th century, from the time of antiquity to the 19th century, meaning a span well over 2,000 years, the most common medical practice, or the most common form of surgery, you could say, performed by physicians or surgeons, was bloodletting therapy. And of course, in the 19th century, when the drug dealers rose to power through allopathic medicine, it was labeled pseudoscience and quackery. But of course, that's not surprising because anything which is actually beneficial for health today has been labeled pseudoscience or quackery. So that's not surprising at all. But I want to get into the history of this because it's very interesting. Now, let's start in ancient India. In the most ancient Ayurvedic medical text, such as the Sushruta Samhita, they talk about leech therapy and they prescribe it for a variety of diseases. And that is the way that they did bloodletting. They would apply leeches to the body of individuals and suck out stagnant blood. And they would prescribe it for individuals who are suffering from muscle pain, joint pain, and skeletal pain. And of course, muscle and skeletal pain in most cases is caused by too high of a buildup of uric acid, which is a consequence of eating too much cooked red meat. And of course, at this time, India was not vegetarian. They were eating red meat. The Indian subcontinent converted to vegetarianism around the Common Era. So you find it in India through leeching therapy, and it was one of the oldest practices that they had. So now let's go to medieval Europe. Now in medieval Europe, leeching therapy was also very popular amongst the aristocracy. Of course, the peasant caste or the bottom caste didn't use it because they were forbidden from eating red meat entirely. But the belief was medieval Europe was that an imbalance of the four fluids in the body, which they refer to as humors, basically blood, bile, phlegm, and yellow bile. They believed that an imbalance of these fluids, which caused the skin to become red, whether in the form of inflammation or fever, was caused by an excessive amount of blood in the body. And of course, this is caused by too much iron because iron builds blood. And so what they did, and they instinctually understood this, was to apply leeches to the body and extract basically iron stores or excessive blood. And again, it provided relief and it was very popular at the time. Now we can go to ancient Greece, and starting from the time of Hippocrates, possibly even before him, you had bloodletting therapy as well. And the Greeks also believed that it was due to buildup of too much blood in the body. And the way that Hippocrates thought of all this was that men, because we don't have a menses, we store and amalgamate toxins, and especially iron, in the body, and thus practicing bloodletting therapy allowed us to purge harmful elements in much the same way that the woman is equipped with the menses. Hippocrates himself theorized that many diseases were caused by an overabundance in the blood, and advised that this overabundance be treated by vomiting again, caloric restriction, sweating, and of course bloodletting therapy. Now, if we go to the Middle East, there's something there called hijama, or wet cupping, and this practice dates back to the prehistory of the Middle East. It's a very ancient practice and probably goes to 2,000-3,000 BC. And essentially what they're doing is that with the assistance of a physician, they create an incision in the back and then apply a suction cup over the incision. And what this does is that it draws out blood, but with the blood, impurities to the surface of the skin and then through the incision with the blood. And again, it's a form of leeching therapy, but instead of using leeches for incision and sucking, they use a manual incision through with a knife and then a suction cup. And again, during the Golden Era, during the Islamic Golden Era, which lasted between the 7th and 13th centuries, and which was a time when the Muslims were pioneering scientific and technological innovation in the world, the most common medical practice was this cupping. But of course, in the modern world, again, it's considered pseudoscience, but whatever. Now let's move on to China. Now, in traditional Chinese medicine, which again is a medicinal system or a medical system which has almost 5,000 years of practice and history, they again have the use of these suction cups, but they refer to it as pulling up jars. And their philosophy on this, according to traditional Chinese medicine, is that cupping is done to dispel stagnant blood and lymphatic fluid. So they believe that the lymphatic fluid and blood in the body becomes stagnant, and this suction therapy basically breaks apart stagnation. And again, the stagnation is largely caused by an accumulation of heavy metals and also cooked food metabolites, even uric acid crystals. So thereby, by breaking apart this stagnation, they also believe that it improves qi flow, or the flow of energy in the body, and it was used to treat a variety of ailments. And now, of course, iron poisoning is one of the primary reasons for stagnant blood, stagnant energy in the body, and it's very obvious with the manifestation or emergence of weak kidneys, kidney fatigue, kidney ache, and dark eyes under the or dark eye bags under the eyes. The dark bags are indicative of weak stagnant blood and weak kidneys. And so the ancients instinctually understood very well how to address these problems. But if you're on the carnivore diet today, you're going to run into this problem. The iron amalgamation and all of that cooked protein and fat will cause stagnant blood. Now, what I recommend for you guys is to do some type of leeching therapy, do some type of cupping therapy, and be donating blood. It's a medicinal intervention through a scientific and anthropological perspective. Thank you all and have a wonderful day.